Hi, welcome to this video about acetaminophen. It's by Alex Ratliff, and this drug video is intended for patients. Do you ever feel like life is punching you in the face? Or do you feel that life is like a soccer ball and it smacks you in the face? Or sometimes when you're sick, do you ever just get a fever that you can't break? Do you ever feel like any of this is happening to you or your family? Well, I have some news. You are now entitled to a pain-free life. If any of those things have happened to you, take some Tylenol, also called acetaminophen. Acetaminophen has been used globally since 1955, and it's been considered a safe and effective pain reliever, also a fever reducer. You can take this orally, rectally, or intravenously. The action of acetaminophen. The analgesic effects of acetaminophen appear to be mediated through both peripheral and central mechanisms. Peripherally, the reduction in prostaglandin synthesis reduces transduction of the sensory nerves, leading to decreased nociceptive impulse transmission. Centrally, acetaminophen inhibits the increase in central nervous system prostaglandins that are induced by peripheral nociceptive transmission. When you have a pain or fever, you want to take Tylenol within 30 minutes to 1 hour. You will see results within 1 to 3, and these results should last anywhere from 3 to 4 hours. Tylenol is contraindicated in people with a previous allergic reaction to it, with the usage of products containing alcohol, aspartame, saccharin, sugar, or yellow dye number 5, or with people who have severe liver impairment or active liver disease. You want to use Tylenol cautiously when people have liver disease or kidney disease, alcoholism, chronic malnutrition, severe dehydration, or when someone has severe kidney impairment, as these can worsen your chances of having adverse effects. These are the following interactions that Tylenol has with other medications. If you are taking warfarin with Tylenol, you may increase the risk of bleeding. If you are using Tylenol with other liver toxic substances, including alcohol, you may increase your risk of liver toxicity. If you are using Tylenol with any of the following medications, isoniazid, rifampin, rifampicin, phenytoin, barbiturates, or carbamazepine, you may increase the risk of acetaminophen-induced liver damage, and these agents will also decrease the therapeutic effects of acetaminophen. If you're using Tylenol with the use of NSAIDs, you may increase your risk of adverse kidney effects. If you're using Tylenol with propranolol, you may decrease the metabolism of it and increase its effects. Acetaminophen does not pose a major threat to health unless it's taken in inappropriate dose or dosages and/or by certain clinical populations. Populations, like previously mentioned, are those with severe liver or kidney impairment, active liver disease, or alcoholism. These are the following adverse effects. The most important ones are acute generalized axanthomatous pustulosis, Stevens-Johnson syndrome, toxic epidermal necrosis, or liver toxicity. Here are some things you need to know to take Tylenol safely. You want to follow the instructions. You do not want to take more than what is recommended. More than 4 grams a day can lead to liver toxicity, renal, or cardiac damage. Adults don't take longer than 10 days, and children no longer than 5. You want to avoid alcohol. Having 3 or more glasses per day increases the risk of liver damage. You want to discontinue the medication immediately and call a healthcare provider if a rash occurs. It can also alter your blood glucose levels, so check those more frequently, especially diabetics. Some pediatric considerations. Parents, check your doses carefully. You want to determine if the formula is correct before giving the dose. Usually it is based on the child's weight or age.